I'm waiting on the sun to rise, waiting on the moon's dim glow, looking so deep in your eyes, wishing that time would slow.
Hello, 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 everybody, and welcome to another episode of Black Scientists Cooperative. And today we are representing HBCUs, everybody, and y'all already know I'm representing Tennessee State University. Thank you for joining. So today is a very special day. Tonight we're going to talk about the Johnson & Johnson vaccine, and we have no other than our very special guest, Dr. Harry Taylor. He is a very dear friend of mine, and we love him so much. So, Harry, let's get started. Can you just first start us off by telling us who you are and tell us a little bit about yourself?
So, I was born and raised in Jersey, East Orange to be precise, also known as Illtown, hometown of Naughty by Nature and other super rap groups. I sort of got my interest in science pretty early on. I was always really good in math and science, and I thought that it was the easiest way for me to sort of get out of East Orange. And so after visiting Morehouse and talking to some of the students there, it became really clear to me that Morehouse was like a really great factory for producing Black men that went on to medical school. And I thought that, well, the best way out of East Orange and to sort of make money and sort of help my family would be to be a neurosurgeon. So I went to Morehouse with an idea that I would be a surgeon. And so when I got on campus, I talked to mentors that were there, and they told me, well, one of the best ways to make yourself an attractive applicant for Johns Hopkins and Duke and the best medical schools in the country would be to have a research experience. And that way you would seem to be more competitive for research-oriented medical schools, which all of those were. And so sophomore year, I went in hard, and I had an early research experience during that school year and during the summers thereafter. And what I quickly learned was that I really enjoyed doing the research. I love the idea of having the intellectual freedom to be a scientist, to be able to shape the young minds of the future and to impact the lives of many others. And so that has sort of got me on the track there. So I went to Johns Hopkins School of Medicine to be a scientist, did my doctoral studies there, and after I had research positions at both Vanderbilt University, Northwestern University, and now I have my own lab at the State University of New York and Syracuse. And my focus has been to understand how viruses interact with the immune system with the ultimate goal of designing better drugs that are better than those that are available now. So.
Wow, that's great. Great intro. And I did not know that you were starting off as wanting to be a neurosurgeon. So what a, a good fun fact.
It was all for the wrong reasons. It's all about.
Oh, don't we know it? So, Mila, do you want to kick us off?
Yeah, sure. I definitely will kick us off. So, Harry, we've been hearing like a lot of chatter on social media and on TV about this Johnson & Johnson vaccine. I've heard people refer to it as the Uchi version of the vaccine when they really want a Gucci, which is the Pfizer or the Moderna. So, what we want to do is we want to kind of give our viewers a fact and database explanation of, how does the Johnson & Johnson vaccine fit into the COVID-19 family of vaccines? So, how does it compare to the Pfizer and the Moderna? Is it really the Uchi of vaccines? I know.
I'm just going to keep it real with you. So the messaging now through the CDC and health officials are, get the vaccine that's available to you. If you have no option, and if the Johnson & Johnson vaccine is available to you and no other is, then that vaccine does have some efficacy. It does prevent severe COVID cases and it does prevent death. But is it really the best available? Was the mayor of Detroit wrong for refusing Johnson & Johnson's vaccine and ultimately requesting Moderna or Pfizer? Well, the data show very clearly that the efficacy of both Pfizer and Moderna are about 94 to 95% effective. The data show that overall, the Johnson & Johnson vaccine is 72% effective. So if you have a choice, am I going to get an A? Am I going to go for the C? Head to head, it's no question. There's no expert physician that will tell you that the Johnson & Johnson vaccine performs as well as the Pfizer or the Moderna. But I'll be remiss to say that if you had no other choice, choosing the Johnson & Johnson vaccine is better than risking your life by being exposed and vulnerable to COVID. And so, second best, third best rather, but if you have no other option, you're going to go for it. So if you have steak, I would say that the Pfizer and Moderna vaccines are sirloin steak filet mignon. And Johnson & Johnson is basically beans and franks. So you make the call on that.
Hey, we'll both get you full, so.
Right, you won't starve.
You won't starve.
And that's critically important to understand. The other thing to stress, though, is that all of those vaccines have all proven to be safe. Each of those vaccines were put through rigorous clinical trials where over 30,000 individuals were tested. And in each case, they prevented death. And there were no severe adverse reactions from those vaccines, at least in the clinical trials with people that were healthy individuals. So things to keep in mind.
I think that's critical, Harry. I think, what our viewers should keep in mind when they're considering whether to take the vaccine or not take the vaccine is like simply what you said. The goal is to not overwhelm the hospital systems like we saw before when COVID-19 first hit the States. We were shutting down ICUs and ERs. People were getting sick and they had no place to go, right? And so, you may get COVID-19 having taken the Johnson & Johnson vaccine, but the goal really is to prevent severe illness, like Harry said, prevent you from having to be intubated, and ultimately the possibility of death. So, I think the message is, like Harry said, take one, take what you can get, if that's your choice.
And I also think that, with the Johnson & Johnson being a one-dose vaccine for those untrackable or untraceable populations where it may not be feasible to administer a second dose within a month, say like the homeless population or an indigent population, it's imperative that they also are protected because they also can spread COVID-19 disease. So I think that, that adds another layer onto our public health initiatives, having this third leg for a vaccine option out there.
Yeah, I think that's an excellent point. And because the Johnson & Johnson vaccine has been the only one to gain approval with just one dose. And you're right, it really does expand the reach of potential protection as these group of vaccines as a class. So
yeah, and that's kind of what I was thinking about in terms of when you outside of effectiveness, and when you relate them to each other, clearly the Johnson & Johnson is not as effective, but still safe. But if you compare them in terms of how they work, or why do we need 2 doses of Pfizer and Moderna, but only 1 dose of the Johnson & Johnson? Can you help our viewers understand some of the differences and maybe even some of the similarities, if there are, between or among those three options?
Sure. So Pfizer and Moderna have been the first vaccines or RNA therapeutics to come online. So as I mentioned, so they're RNA vaccines. And so this is sort of mysterious for many people that forget their high school biology. But every cell in your body produces RNA. Viruses, many viruses also produce RNA. And so RNA in itself is not harmful. And so our genes in every cell of our body are essentially blueprints to make various proteins in our cells that essentially make us us. And so the Pfizer and the Moderna vaccine have essentially, if all of our genes represent an encyclopedia of information, the vaccine is essentially a page of instructions that provides our body, our cells in our body, with the information to make what's called the spike protein. The spike protein is from the virus, and it uses this spike protein to infect cells. And so when the Moderna or Pfizer vaccine provides this RNA, which is the instructions to make the spike protein, that is foreign to our bodies. And anything that is foreign to our bodies, we try to fight it off. And our immune systems react to that and will make antibodies against that foreign protein, which will then prepare our bodies for when we really encounter the actual virus. And so Moderna and Pfizer are very similar in that way. Again, RNA vaccines. The Johnson & Johnson vaccine is a completely different delivery system. Instead of using RNA, it uses a shell of another virus that's generally causes a cold, and it's called adenovirus. And it's a shell of a virus that delivers the blueprint to make spike as well. And so rather than using the RNA, it uses the shell of a cold virus to deliver the information that also allows our bodies to make spike protein, which we make antibodies against, and it essentially preps our immune system to fight off the virus when it encounters it.
Wow. Thanks for that, because I think that was a good review, because I know we had spoke about that before of the vaccines of Moderna and Pfizer and how that all worked. And so it's great to hear you talk about the Johnson & Johnson one.
Yeah.
But I think...
But one quick thing to add to that.
Okay.
So the Johnson & Johnson vaccine is one dose, one shot.
Right.
Moderna and Pfizer are both two shots. So the Moderna vaccine, you get your first dose, and 4 weeks after that, you get the second dose. With the Pfizer vaccine, you get your first dose. 3 weeks after, you get your second dose. Johnson & Johnson, one shot. And the reason why that's the case is that that's from experiments through clinical trials. They showed that in clinical trials and with volunteers, with one shot with the Johnson & Johnson vaccine, it was enough to build immunity. Whereas with the Moderna vaccine and the Pfizer vaccine, they showed in the similar clinical trials that it took 2 doses to fully protect people. And so the data was used to direct these sort of guidelines.
So
before you move forward, I just want to call out just this one thing that Harry mentioned, the adenovirus piece, just again for our viewers, for them to understand that that's the proven method of vaccine creation, right, Harry? So that's like, if we were talking about the gold standard of vaccines that are currently in the market and what people are using to get, that's the method, right?
Yes, and so there's an vaccine that uses a similar strategy. There are other vaccines, many flu vaccines that are attenuated viruses or weakened viruses that deliver the necessary information or the necessary antigen to prime our immune systems. And so the Moderna And the Pfizer vaccines, these RNA vaccines, are new though.
So if you have a fear
on the
about,
market.
yeah, so if you have a fear about the whole new technology thing and the whole RNA thing, because I know a lot of people that are scared because this is a new method, then Johnson and Johnson might be your route.
Yeah.
Right.
Well, so the thing is, it's a new method for delivering a vaccine, but the technology in itself is decades old.
Yeah.
There are many studies, many FDA documents that show that RNA delivery systems are safe. They just weren't effective in some of the strategies, the therapeutics that they were designed for, but they're absolutely safe. And as I mentioned earlier, to sort of underscore the safety, every cell in our body utilizes RNA, messenger RNA. And so RNA in itself is not dangerous, it's not harmful. And the RNA that is used in the Moderna and the Pfizer vaccine are essentially providing the instructions to make this spike protein from the virus, which in itself is not a danger.
So I'm sorry, go ahead.
No, I said it's not a danger, it's not toxic.
So in, development of, as we, we learn more, we do more, and we do better, right? You know better, you do better. And moving from this 2-dose system, or actually adding to the 2-dose system to this 1-dose system, do you know of or foresee others, getting into the COVID-19 vaccine game, either as a one single dose or a dual dose system?
So there are other vaccines that are in the pipeline. There's a vaccine that has been making its way through approval it's put out by AstraZeneca in Oxford, but
I thought AstraZeneca had to pull back because they were having some technical difficulties per se. And so they kind of stepped back a little bit in the game.
Well, but the thing is that they had some early hiccups,
Mm-hmm.
but it has still made its way through the approval process in England. But again, there have still recently been some concern, but the jury is still out as far as how safe it is and how effective it is. But again, it's just a matter of time to see. But again, it's not on the track for being FDA approved here in the States. But
right.
one other vaccine manufacturer, Novavax, has a different sort of strategy. And so as I mentioned earlier, the RNA vaccines provide instructions for the cell to make spike protein. The Johnson & Johnson vaccine provides a shell of a virus to deliver the information to make the spike protein. Well, Novavax's strategy is to provide the immune system with the spike protein directly. So it doesn't provide the cells or your body with the instructions to make the spike protein. It delivers these particles with the spike protein already on it, and your immune system sees it and also makes antibodies against it. Those are called subunit vaccines, which again, it's a different strategy, but the end game for all of these vaccines is to make spike protein. It's either to utilize your cells to make the spike protein or to deliver it directly. And because the end result is to make the spike protein or to present the spike protein, your immune system is essentially going to do the same thing and generate antibodies that are directed against this critical virus protein. And so clinical trials have demonstrated that the Novavax subunit vaccine is about 90% effective. And what's really nice about that is that it's also been shown to be highly effective against we've been hearing about all these new mutations, all these variants. The Novavax vaccine is also effective against these variants as well. And so that's another potential
game changer
in the kit to fight this COVID pandemic. So that's really nice to have that one come along as well.
But bro, you were talking about multiple vaccines to target the same virus. So
Yeah.
why develop so many vaccines and it's just for COVID-19? Like, why is everybody doing a vaccine now? Like, why not just come up with one? What's the reason?
Well, it's pretty simple. COVID hit us hard.
Mm-hmm.
Hard. What are we up to? 520,000 deaths, whereas yearly maybe 40 to 50,000 people max die from flu. And so here we are at about an order of magnitude more deaths. It's a very serious thing. It shut down our economy. And so at that point, it was a mad race to design a vaccine that was effective. So obviously the big pharma was involved in this, and they felt that this was a potential moneymaker. And from a strategic point of view, we didn't have the time to waste to say, hey, we'll try out vaccine X. We'll see how that works. And if it works or not, then we'll try vaccine Y. No, all these companies pursued their various strategies in parallel. And the idea was, it's a race. Whoever gets the vaccine first, that's effective, and if they can produce it in mass, wins the game for the most part. And there were various incentives. The government, through this Warp Speed program, provided hundreds of millions of dollars to Moderna and other companies, which again expedited the entire process. And so the idea was that it was a competition. It was an open competition, and each of these companies saw or thought that their strategy would be the best. No one knew how effective the messenger RNA vaccines produced by Moderna and Pfizer would be, because we don't have any messenger RNA vaccines on the market now. And so we could not put all of our eggs in the basket for that reason. It was just too much at stake. So there was obvious monetary gain from this, but from a public health standpoint, we didn't have time to waste. We said, hey, companies were going to pursue all these strategies in parallel. When they're all available, we'll try them out. Whoever is the best, they win the pot.
I think it's also critical to say that this is only the beginning. So like with any other therapeutic or medical device, approvals are constantly changing, and you're constantly getting, additional claims. So Johnson & Johnson is a one dose right now. Who knows what it will look like 12 months from now. And to Harry's point, all of these companies are competing, and each one will have they'll position their vaccine in a different way to differentiate them from the rest of the competition. And so it'll be a fight to the finish to see who gets to the revenue. The other piece of it is these companies are also looking at this globally, like beyond the US. So while our numbers are going down, our rates are going down, and our population is being vaccinated, there are countries over in Europe that are going into a third lockdown, like Poland, because their COVID numbers are going up, because the US, we're kind of consuming a significant amount of the vaccine that's available in market. So these companies are also like, okay, well, Pfizer and Johnson & Johnson and Moderna have the US on lock, but there's still all these ex-US markets that still need vaccine, right? So it's a broader conversation than just like what's happening and what we're seeing here in the US. There are countries that are like going right back into lockdown and seeing their hospitals become overwhelmed again.
Yep, that's an important point, is that very early on, the US and other wealthy countries invested hundreds of millions and billions of dollars to shore up and secure these doses. Moderna and Pfizer can't keep up with the demand right now. And the US and major companies have this on lock. And I think it was announced either today or yesterday that the US is thinking about donating some vaccine doses, but not the Pfizer and the Moderna. It may be Johnson & Johnson and AstraZeneca. So check this. They're not giving up the steak. They're giving up the beans and franks. which is, you may want to think about why that is.
I like that. Wow. This has been such a great conversation. And I wish we can go on and on, but we're going to have to bring you back for sure to talk about we want to pick your brain some more. So thank you so much for joining us. And thank you to our audience for tuning in this week. And any final words from any of the panelists today?
No.
All right. Well, if that's it, then we will call it a day. Thank you. Peace, y'all.
Have a good night.
Have a good night.
Right.
Deep flows like a breeze flowing through me, from my head to my feet. Your love runs smooth, ooh, it soothes, and you're making life right. I'm so glad that you're mine, you're mine.